Hi everyone, I'm Dr. Natalie, a chiropractor with a special interest in movement and recovery. In this video, we'll go through 5 of the best exercises to help reduce pain and discomfort from hip bursitis. Hip bursitis often causes a deep ache or sharp pain on the outside of the hip, especially when walking, climbing stairs, or lying on the affected side. It typically occurs due to weakness or poor activation of the glute muscles, particularly the gluteus medius. Before we show you a few exercises to help with hip bursitis pain, I would like to go through some don'ts to prevent aggravating the pain. So the first one is don't lie on the painful side. Lying directly on the side that's affected can worsen the irritation of the bursa, the fluid-filled sac that helps reduce friction between tissues. This pressure can compress the already inflamed area, making the pain worse and slowing down recovery. Instead, try lying on your back or the opposite side with a pillow between your knees to keep your hips aligned and reduce strain. 2. Don't cross your legs while sitting. Crossing your legs might feel comfortable at first, but it actually places uneven pressure on your hips and can overstretch the outer hip structures. Over time, this position can aggravate the bursa and the surrounding tissues, making the pain more persistent. Keep both feet flat on the floor and your knees at hip width to maintain balance and support. 3. Don't push through sharp pain. Pain is your body's way of signaling that something's wrong. While gentle movement and activation can support healing, pushing through sharp or intense pain can cause further inflammation or even tissue damage. The key is to find the right level of activity. Think low impact movements, gentle stretches, and avoiding anything that causes a stabbing or burning sensation. Alright, first exercise is glute bridge. To perform a glute bridge, start by lying on your back with your knees bent and your feet flat on the floor about hip width apart. Let your arms relax by your sides with your palms down. Take a deep breath in, and as you exhale, gently squeeze your glutes and lift your hips towards the ceiling. Your body should form a straight line from your shoulders to your knees at the top. Hold that position for 2 to 3 seconds, then lower your hip back down slowly with control. I recommend starting with 10 to 15 repetitions, and you can repeat this for 2 to 3 sets. Now a few things to watch out for. Try not to arch your lower back as you lift. This isn't about pushing up through your spine, it's about engaging your glutes. Also make sure you're pressing through your heels rather than your toes. That small shift makes a big difference in activating the right muscles. The second exercise is side-lying clamshell. Start by lying on your non-painful side with your knees bent and feet stacked together. Place a small pillow between your knees to help keep your pelvis in a more neutral, stable position. Make sure your hips are stacked and your core is gently engaged. From here, slowly lift your top knee while keeping your feet in contact like a clamshell opening. Only go as high as you can without letting your hips roll back, then lower down with control. This movement activates the gluteus medius, a key stabilizer of the hip joint, which helps reduce pressure on the inflamed bursa. It's important to move slowly and with control. This isn't about speed or range, but it's about engaging the right muscles. Do 2 sets of 10 to 15 repetitions on the non-painful side. This allows you to strengthen support around the joint without aggravating the inflamed area. The seated clamshell is a great low-impact exercise to gently activate and strengthen the hip without irritating the inflamed area. Sit upright on a chair with your feet flat on the ground and your knees bent at about hip width. Place a resistance band just above your knees, or you can do this without one if needed. From here, slowly press your knees outward, creating a controlled opening movement, then bring them back in. Keep your upper body still and focus on moving just through the hips. Try doing 2 sets of 10 to 15 reps, nice and slow. The standing hip abduction. Stand tall next to the wall or chair for support. Slowly lift your affected legs straight out to the side, keeping your toes pointed forward and your body upright. The movement should be small and controlled. There is no need to kick high. Pause briefly at the top, then lower your leg back down with control. If you want more challenge, add a resistance band just above your knees. This will increase the muscle activation while still being gentle on the joint. Try 2 sets of 10 reps and focus on keeping your core steady and not leaning your upper body.